Welcome to Technovation. I'm your host, Peter High. My guest today is Anil Bhatt. Anil is the Global Chief Information Officer of Anthem, one of the largest health insurance providers in the United States, earning roughly $137 billion in annual revenue. The company is an independent licensee of the Blue Cross Blue Shield Association. Anil's been with the company for roughly 14 years, and he served in a number of roles prior to this current one, including as Chief Technology Officer and as Vice President of Digital Technologies and Transformation. In this interview, we discuss the remarkable work he and his team have done in the ascent of technology at the company. Anil covers the work he and his team are doing to humanize the solutions Anthem provides, making technology more empathetic as the pandemic has accelerated people's willingness to engage with technology. He also talks about the way Anthem is leveraging artificial intelligence and how it's helping to bring about experience personalization across a variety of constituents. Finally, Anil touches on how he structures and facilitates collaboration across the large team he leads, the trends in technology that are on his radar, and he shares some of the secrets to his professional success. Anil Bhatt, welcome to Technovation. It's great to speak with you today.
Awesome. Great being here. And thanks for the invitation. And I look forward to the conversation.
I very much look forward to it as well. Well, Anil, you are the Global Chief Information Officer of Anthem, a significant company, a company of consequence. I wonder if you could just take a quick moment for those who may be less familiar with it, just to provide a sort of a thumbnail sketch of the company, and also, very importantly, your purview as Chief Information Officer.
Awesome. Great. Anthem Incorporated is one of the leading health and benefits company in US, and we are soon going to be Elevance Health. We are going through a rebranding, making sure that we update our name with the purpose with which we are leading the company. And at a high level means we are dedicated to improving the health of our members and our communities and making healthcare simpler in general. Anthem serves approximately around 118 million people right now, and we directly influence the health and wellness of around 45 million members. And our mission is to deliver health beyond healthcare and making sure that we are committed to being the lifetime health care partner for our members. Beyond that, I think from a role perspective, I lead the technology here at Anthem, and basically, focused on making sure that we are enhancing our IT operating model, where we focus on lean core technology, making sure that we have a very API-enabled ecosystem focused on multi-cloud strategy, as well as making sure that we are building platforms that connect our experiences together. And at the end of the day, serve our members in the way we expect to be served when we are going outside to any service organization. In terms of scales, Anthem Global IT organization is around 12,000 to 13,000 people, spread across states, Israel, India, and Philippines. And we recently opened our offices in Ireland also. So, as the Global Chief Information Officer, my role is to make sure that our global IT model is unified in terms of providing the solutions that our business partners are looking at, taking advantage of the global workforce, making sure that we are hiring and retaining talented people to make sure that our business needs are met on a day-to-day basis, and frankly, bringing different cultures to go along together as we humanize and bring personalization and empathy to the overall solutions we deliver. So, very privileged to lead that work here at Anthem, and look forward to a lot of innovation as well as a transformation that we are going to bring to the overall healthcare industry.
That's a wonderful overview. Thank you for it, Anil. And I want to focus on a point you mentioned there close to the end of your response, one about empathy. And when one thinks about empathy, one thinks about interpersonal communications, perhaps the way in which you and I are treating each other in this conversation and reacting to each other's reactions, and listening and eliciting appropriate responses based upon that human connection. I know you've been thinking a lot about making technology more empathetic. And I wonder if you could talk a bit about some of the drivers that you're using in order to do so, and maybe even just the broader philosophy of doing so as well, as perhaps for some people it might seem almost like a paradox of sorts.
Yeah, well, I think, very good question. As a tech leader, when I constantly evaluate my own role in the organization, what I clearly see is that there's a need to ensure that Anthem has definitely a robust and innovative technology engineering workforce, but also making sure that we are understanding all the business pieces that are coming together to make sure that we are serving our members in the right way, right? And if you look at the world today, we can order food sitting on our couches. We can make sure that we are booking any tickets, doing most of the activities that for which we would have had to get out of the house, go out, then come back in. We are really making sure that the technology provides on your fingertips everything that you need. But at the same time, the technology is not doing just that. There is a very personalized interaction that is happening out here. There's empathy, there's service that is really at a very top level being done, whether it's e-commerce, whether it's hotel industry, a lot of whether it's airline industry. The empathy is kind of building into everything that we do, and making sure that we understand our members from that perspective is very important. And I think the approach that we call out here is tech equity. What it is basically bringing together the technology and equity, where the equity of care, the equity of access to the healthcare, well-being, our community resources is very, very important. So how do we make sure that technology is enabling all the aspects of all these things that we want to do is very, very core and center of how every engineer in our company is leading. And I think that connection is very important. And our goals from a technology perspective are very much tied to what we want to do from a healthcare and quality of care perspective. So once you bring those together, I think the empathy, making sure that we are becoming a digital platform for health, wherein access to key things are there, making sure that, whether it's virtual care, whether it's, you want to have an urgent care visit while on a Saturday morning, somebody in your family got hurt. How are you able to do that? If you could not do that, when you connect with us, how are we able to look at your 360-degree view using the data and AI that we have? And we are able to empathize with you and making sure that we are directing you to the right place. We are helping you in that particular journey that you are on at that moment. And the tools that we have developed really complement that. So I'm going to talk about a little bit more about our mobile app. I'm going to talk about data and insights. But those are the things that basically we want to make sure that not only products are delivered, but the empathy along with the product is very visible and front and center of everything that we do.
Can I ask a related question, Anil, which is, I wonder how the pandemic has been an accelerant for people's willingness to engage with the technology in ways that they may not have in the past. I can only imagine in many ways that it's provided opportunities to expand the aperture of how you and the team think about engagement with customers in the various stripes that they are. Talk a bit about that, if you would.
Yeah, so I think definitely we were on a digital transformation journey, and I think most of the companies were going in that direction before the pandemic. But what pandemic did was, rather than going to that destination, the destination was brought to you and said that, hey, you know what, you gotta make sure that you are hitting that point. So I think what we have done is definitely there has been an acceleration in some of the key things that we were planning to do, and which were a multi-year effort that we have squeezed into a year or two, like the COVID vaccine. Usually vaccines take a long time, but we had to rush it. We had to, implement it very quickly. So we have seen that. We have seen a lot of digital as well as technology tools and business-led initiatives, which were digitally focused, being delivered in a quick turnaround time. And in terms of the engagement and uptake, I would say that we have seen a great deal of, engagement as well as adoption of these tools by our members, providers, brokers, everybody else. And I'll take a couple of examples for you. For example, before the pandemic, the chat volume was less than 5% for us. When a member used to interact with us, either they used to go to the website, and if they couldn't find anything out there, they would just call us, right? And what we have seen is that we have now 77% of our interactions are digital. People are actually going to the website, they're going to our mobile app and using the mobile app as the way to interact with us. Now, if they cannot find something out there, they are going to chat. So our chat volume in our commercial business has gone up to like 22 to 25% of our total interactions. So people who used to call us now are preferring to do a chat with us or messaging with us. So that trend has increased, and we have seen that adoption has gained momentum there. In terms of providers, we had 0 provider chats 1.5 years back. Right now, we have 27% of interaction with our providers are via chats. So the acceptance of the digital tools, making sure that they have a reliance and basically they can trust the channel is very, very important. And what we have seen is that has worked in our favor in terms of making sure that we are able to make inroads. And that opens up the doors for other things that we want to do. Now they trust us, and we want to make sure we can expand based on that trust that they have on us.
Very interesting, and interesting to hear more about the ways in which technology and some really interesting elements of it in terms of interactive technologies are on the ascent. Another technology that I know is on the ascent at Anthem is artificial intelligence. And I can only imagine you've been with the company for nearly a decade and a half. And I won't speak for Anthem or your experience, but for a lot of companies 14, 15 years ago, AI probably wasn't really a big strategic aspect of their roadmap. And now something that most organizations, especially those at scale, have been thinking about leveraging to a greater extent. I wonder if you could talk a bit about its evolution with, of course, a special emphasis on the value you anticipate deriving, today and in the near term as a result of leveraging artificial intelligence.
Definitely. So I think, Anthem with the number of members we have the privilege of serving has always been a data-rich company. Whether it's claims data, whether it's, cost of care data, whether it's member information, we have been a very data-rich company. And, when I joined the company, and as an engineer, the focus was really making sure that tech is enabling the business in the needs that they have. And it was really more business-led conversation, and tech was enabling some of the things here and there. Then we kind of shifted to more modernization of the technical stack and making sure that we are rationalizing some of the systems out there. And gradually after that, the focus became customer experience and the digital tools that we have. And as we did that, one thing which became very clear with the Netflixes going around, you can see your recommendation, what movie would you like and stuff like that. The customer behavior kind of started to change. And I come from an e-commerce background, so I knew that the cross-sell and upsell of things is very, very important to the member, because they get to see what could it be without really have to search for it. What shirt matches your pant right now, right? So the personalization of things really matters at the end of the day. So when we looked at, okay, what do we have out here that we can explore and kind of develop on? A few years back, with the help of our other technology leaders and data officer, what we found out was that the amount of data that we had, we could really make sure that the AI aspect of things, really simulation of cognitive behaviors out there, and making sure that the computer performs those intellectual tasks that really we are leaving on, our associates. How can we identify those? So what we have done is basically created great data platform that builds on top of it a lot of AI engines that we are using. And what we have done is basically focus on member experience. So personalization, which is a great topic for us, wherein, how do you personalize the interaction with a member? How do you look at their claim history to provide them content that is really relevant to them? How do you make sure that you look at the pharmacy record and provide them, okay, these are the things that you're not doing, what you should be doing, get care gap alerts and other things. So focused from a personalization perspective. Then also we are looking at fraud, waste, and abuse. Our program integrity is using a lot of data that is coming in from different providers and hospital systems, looking at fraud and abuse that is happening. How do we control that? How do we bend our cost of care trends using data as an enabler? So AI basically is front and center of a lot of things that we are doing. The symptom triage function, for example, on our Sydney Health app is actually that. The AI is reading what are you going through and what could be the reason why you're calling us, or why do you need to see a doctor? And the other aspect which complements as part of the AI is the machine learning on concept. So we are very heavily focused on machine learning because we don't want to just build the models on the AI. We do want to make sure there's a continuous learning of these models. These models are adapting themselves, making sure they're learning not only from a manual process perspective, but also what is happening from an AI perspective. So, over the 14 years, I've seen a lot of change out here. Our focus to more personalized and more direct engagement with our customers and providers and other stakeholders has really pushed us towards that AI first mentality in everything that we do. And we are seeing the results which are really positive for Anthem and really reflective of the purpose that we are leading with.
You allude to, Anil, the number of constituents that you engage with, members, providers. It includes brokers, people that are shopping for care options, et cetera. And that's by no means an exhaustive list. But as you think about personalization across the variety of different constituents you have more than the average CIO to think about. A retailer, to take a standard example, drawing from an example you gave earlier. Perhaps there's a certain set of products. You're a consumer electronics retailer, and the people who are coming to your store or to your website or your mobile app have a certain bundle of things that they're going to be looking at as a result of the brand that you have in the world. Your customer group, if you will, that you are serving is much more diverse. And I wonder, especially as you think about a topic like personalization, which has rightfully come up in a couple of very interesting ways in your responses. How do you think a little bit about the voice of the customer, if you will, or circling the customer and personalizing for them when there's so many differences to the customer that you're serving, if you will?
Yeah. So I think, when we look at our stakeholders, and you rightly said, there's members, brokers, employers, our providers, everybody in that. I think at the end of the day, everybody wants to have very good interaction with Anthem, and they want to make sure that they are served the best way possible. Now, there are some foundational things that are very common to the platform that we have. Whether we look at data, the segmentation of the data, whether it's the API layer on top of that, whether it's multi-cloud strategy to make sure that we are able to have the resiliency, scalability, and other aspects of enabling these experiences out there. So I think there are some common things, whether it's a multi-cloud strategy that we have right now going on, which basically gives us the flexibility of developing tools to make sure that they serve across all the stakeholders. The API layer that we have right now, which really provides a very secure way of interacting with the data in the live, live way, and then also making sure that we have some common, technologies that are serving all the stakeholders there. Then there is a definite uniqueness. So we go ahead and we have what we call with a human-centered design thinking about each stakeholder. Right. So we recently launched our Broker Plus app, which was for brokers. So brokers used to interact with us, and they used to have a lot of paperwork. They used to have a lot of engagement with us. But at the same time, they couldn't do a deep dive into their book of business. They could not really identify, okay, what are the applications that are pending out there? And they could not interact with us in different ways. So when we did the full human-centered design thinking and journey analysis for them, we found out exactly what they need. So we built tools which were exactly what they need, but it has the same, what I call multi-cloud data, as well as the mobile foundation that is in the Sydney Health app, which is serving the members out there. So there's a commonality out there, which we are scaling on. Now, we did the same thing for members and kind of did the research out there. And what we found out was that the data that we were collecting out there from an engagement perspective had different flavors out there because the needs were different. But at the end of the day, empathy, making sure that they are able to get to the answer very quickly, making sure that we identify the top 5 or 10 things that they want us to be able to serve them very quickly, were very common. And we were able to define our experiences exactly in the way they need it. So learning from the data, really investigating the data, putting our surveys and foresights in the front really help us to make sure that we are able to kind of learn and then adapt to what they need. But our experiences across the board, we want to make sure that they are serving the stakeholders in the best way possible. And then we keep updating our experiences as we get the feedback. And that is the quick turnaround, the agility that we have been able to get with the cloud enablement that really is allowing us to do that. So hopefully that covers a few things out there.
That's wonderful. It's a great overview, Anil. I really appreciate that. Interesting to get that perspective and the way in which you organize the team to best serve the various constituent groups that you mentioned. Speaking about organizing your team, you mentioned you've got a team of 12,000 associates. You also mentioned the distribution across the world of the team itself. Anthem is a massive organization. Besides that, talk a bit about how the team is organized, if you will, in order to ensure that you're sort of drawing and collaborating from across the significant presence that is your company to elicit and understand where you can serve different parts of the organization best. How do you organize your team, such a vast and complex organization as the one you have?
Yeah, so I think, first and foremost, I would say that before the organization of the team, really the culture of the team is very, very important. How do we make sure that we have a team that really focuses on the outcomes, that the team that really knows exactly what our customers and stakeholders need on a day-to-day basis, very business oriented, but at the same time having the empathy and the customer service experience, and how does anything that they do on a day-to-day basis impacts the service that we provide to our members. That is the front and center of the thinking that we have. So we lead with that. In terms of organization of the talent, as you said, and you know that we have talent primarily in India at different locations out there, and US we have distributed. The flexibility is one key thing that we want to make sure we provide our associates, where they work from, how they work from, but at the same time, giving them a common place to come in when they want to celebrate. We have offices in Atlanta, Mason, Cincinnati, all over the place, which gives them an opportunity to kind of get together and kind of celebrate the wins that they have, as well as initiate new things that they want to do. So that's foundation to everything that we do. In terms of organization, in a traditional way, we do have different, CIOs and CTOs, which are aligned to a particular line of business. And they basically focus on making sure that from a line of business perspective, they understand what are the specific things that we need. For example, I have a CTO leading the infrastructure and services and everything that we do from an associate perspective. So across the globe, what are the needs from an associate perspective, our network, infrastructure, and everything? That is the responsibility of the leader out there. Then at the same time, we have a leader who's leading the cloud migration, as well as the cloud strategy and our overall API and platform delivery out there. These are two foundational services across the board. And then we have enterprise architecture built into that. Then we have teams which are focused on, as I said, the line of business. But at the same time, we do not differentiate and don't treat our offshore teams as somebody we can throw the work in the night and then next morning they deliver it to us. Our teams are very agile, very integrated. So when we talk about a Scrum team or multiple Scrum teams, they are comprised of talent which is here in US as well as in India or Ireland, and they work together to make sure we deliver the things. With a common purpose out there, the underlining thing is that with a common purpose, and they know exactly what the goal is. So, we want to make sure that we are giving them enough flexibility and tools that they can kind of develop the things as we move forward. But that is the idea, is that making sure that you have a business focused leadership out there, making sure that we understand and know exactly the need from a business perspective, but at the same time, a common foundation which enables us to quickly develop things, irrespective of where the talent is sitting, is what we are focused on.
That's great. I appreciate that overview. I wanted to ask you about trends that excite you. We've talked about a number of them: artificial intelligence and its use. You talked about machine learning, mobile apps, and chatbots, and the ascent of those, and the increased adoption as a means of interacting with customers as additional examples. What other trends excite you, Anil, as you look to the future?
Yeah, I think funny enough, I was asked this question. I was at a panel recently, and I was asked the same question. I'll give you the same answer. So recently, I had an experience wherein, one of my family members got a small bite from our dog, and it was a few weeks back. And in the evening, the urgent cares were closed, and we were like trying to figure out what to do. And I called my doctor friend. Now, my friend is not our physician, so he could not prescribe something. So he said, you know what, I think she should get an antibiotic. So you will have to make sure that you visit the doctor and kind of do that. Guess what? That urgent cares were closed. It was not an emergency that we wanted to go to emergency. So we picked up our app and actually virtually connected with a doctor within 30 seconds. And we had a visit. She saw the bite. We kind of explained exactly what we're going. And the doctor was able to look at the injury, diagnose it, tell us exactly what to do. And basically, she prescribed us an antibiotic. We went and picked it up in 45 minutes, and voila, everything was fine and dandy. That's one of the examples where the virtual care and the power of virtual care in different settings. I'm really, really excited about that. What it can bring to the lives of many, and if we start using and adopting that, is going to be very, very differentiating in the long run. But more importantly, I think I'm very excited about the personalization driven by AI, which is part of our Sydney Health, Anthem Sydney Health application, our mobile app, which basically allows us to nudge the members at the right time and really provide them with what they should be doing, where influence their behavior in general, and really have a more highly personalized and targeted interaction with them. That is really very exciting for me to see. We have embedded a AI-driven nutrition tracking tool into our app. So while you are eating a food plate or anything else, you can just point to your Sydney Health app and it will tell you exactly how many calories you're eating. You can log those calories and make sure that you move forward and adapt to the way the healthy habits we want to build in the members. We basically have a lot of opportunities around content push to our members who really need that push because of their health condition. One key thing, Peter, I would say is that, as I said, we have a lot of data. So we have a lot of information about Anil in our data. And we have a lot of information about people like Anil in our database, right? So somebody who was the same age as me many years back, what condition they have right now going on in their life, and what do I need to tell Anil so that he does not end up with that condition? What do they need to change in their lifestyle and everything is very, very exciting. And I think the value of that, if in case we are able to penetrate that within the marketplace, within the members, is huge. We are working on that and actually is part of our overall roadmap in terms of really elevating that information and personalizing that. So that's what excites me. I hope that comes across in my conversation, that this is a field that I'm really excited about and look forward to transforming that as we move forward.
Well, your passion for this topic is certainly very inspiring. Somebody once told me a few years back that most of us have better information on the health of our vehicles than we do on ourselves. But now, through the variety of aspects of what you've described and the increased use of wearables, for example, and the ability to accumulate data even as we're doing other things, will enable us to have that personalized experience and give us the relevant nudges based upon our unique needs, yours and mine, and everyone else's. Very, very interesting.
I think it is a very, very interesting field, and fortunate enough to be with a lot of 90,000 Anthem associates who basically are really working in that direction. And our leadership is very clear that we want to make sure that we are not just another claims processing company. We really care about our members. We are really looking after them. And we want to make sure that we can make a difference in their lifestyle using technology as its foundation out there. So I totally agree. A lot that we can do. And hopefully we'll see that trend changing as we move forward.
That's excellent. I wanted to ask you to close here, Anil, as someone who has ascended to such a high perch in the technology field in the biggest sector of our economy in healthcare, I wonder if you, as you reflect, looking back on your journey, what were some of the difference makers for you, some of the secrets to your success? And if I can ask you to tune your reflections as though perhaps you were providing advice to somebody a couple decades younger than you who might wish to follow in your footsteps, what are some things that come to mind?
Yeah, I mean, I think, first of all, I was fortunate enough that I got this opportunity to work at Anthem. I would say that one of the best companies I've worked for, and a place where I've grown. I joined this company as an engineer 14 years back. And when I look at my journey, what I would say is that I was never satisfied with what I was doing at that moment of time. I always had inquisitiveness to learn more and see what are the other places doing. Do what you're doing to the best of your ability, but always strive for a little bit extra. That is one thing that I've always tried to do. Make sure that you're helping others and taking the team along. The most important thing that for me in this tenure is the team that I have. I have people who I started working here 14 years back, and they're still with me, and they're still part of the team in different varied capacity. Building a strong team around you, really making sure that you have leading with trust, leading with empathy, and building a team that really understands the core value with which you run yourself is very, very important. So having that around you is key. I've led with Anthem first, my team second, and then myself. And basically that mantra really serves you well, because at the end of the day, you're taking care of the company and the mission that the company is in. So Anthem has a great mission. We are serving members. We are making sure that we're improving the health of humanity. We are making sure that we are making inroads into the communities. And when we lead with that purpose, and then we make sure that our team understands that, and team is paramount for me. When they are happy, I'm happy. And at the end, when you do those two things well, everything else will fall into place. The grit that you have to overcome obstacles is very, very important. I think I've had that grit wherein I've had challenges. We had sleepless nights, 96 hours, 120 hours of continuous work, but never gave up and made sure that we are being successful at the end of the day. And then making sure that you're learning from every leader that you interact with during your journey, and picking the best out of them, and making sure that you ask them a question, not only what made you successful, but what are the mistakes you've made, and learning from those and not making those mistakes, or trying to avoid those things as much as possible. And I'm fortunate enough to have had interacted with so many great leaders out here who have either been in this capacity earlier, or basically I've directly or indirectly worked with. And I've kept a very open mind in terms of learning from them, in terms of making sure that I'm picking the best advice from them. And then externally also building connections that who can really influence your strategy and influence the way you work, and keep an open mind about that has been key. And at the end of the day, as I said, fortunate to have a team who is doing the work on a day-to-day basis, allowing us to strategize at a high level has been key. So the full credit goes to the team, and then I'll take it after that.
Well, that's a wonderful response, and I appreciate your reflections on your journey. Anil Bhatt, thank you so much for joining me today, sharing some stories and perspectives from your remarkable tenure at Anthem, the ascent of technology within the company, and by extension across the industry and society more generally speaking, as well as your vision for the future, that vision that you and the team at Anthem are driving. It's been an inspiring conversation. Thank you.
No, thank you very much for having me, and great conversation. I look forward to interacting with you more. But I really appreciate the work that you're doing in terms of bringing these podcasts to the people, and I hope these are useful. But thank you very much for having me here.
Absolutely, and go Bengals.
Go Bengals.